Hello, welcome to Chatting with Chitness. I'm Dr. Salil Chitness. I'm a pediatric emergency medicine physician, and we're going to be talking about pediatric medical education. We got a very exciting video, so let's get chatting. Hello, and welcome back to Chatting with Chitness. Today, we have a video about the scary things in your newborn. We've had two videos about the normal things that you don't have to worry about. But today we're going to talk about the things that are serious and what you really have to worry about. So let's just get chatting. So the first thing that you really need to go see a healthcare provider is if your newborn baby has a fever. Fever is defined as 100.4 or more. Another thing that most parents don't realize is a low temp is also very dangerous, and a low temp is less than 97 degrees Fahrenheit. And the reason why we worry about fever or low temp is that this is the biggest sign that there is an infection. And if it's a serious infection, your baby's immune system hasn't developed yet, so they can, get very severely sick from the infection. The next thing we worry about is breathing. So your baby should never be breathing 60 breaths per minute, that's a breath a second, for 2 hours or more. Sometimes they'll breathe fast for a couple minutes. That's periodic breathing. It's completely normal. But if they're doing this for 2 hours or more straight with no breaks, then you need to get help. The next thing, which a lot of parents don't know, is that your baby shouldn't be sweating when they eat. And when I mean sweating, if they're touching you, they're going to be sweaty there. But if their forehead has sweat and they're really struggling to eat, that's a sign that maybe something's wrong with their heart, and you need to investigate that further. The next thing we worry about is weight gain. Your baby needs to be gaining 15 to 60 grams a day on average. So if they're gaining less than that, then something is up and further investigation is needed. A very dangerous thing that your baby can do is if they vomit bright green. You need to go straight to the emergency department right away, because they could have a very severe intestinal obstruction that needs surgery right away. And you only have a little bit of time to fix that. So bright green vomit is very bad. If your baby ever has less than 3 wet diapers in 24 hours, that means they're dehydrated, and you should probably have them checked out and see what's going on. And then the last thing is turning blue. You never want to turn blue, because that means you're not getting enough oxygen. A lot of babies turn red. A lot of babies turn purple. That's okay, but blue is bad. I hope this helps. I hope this never happens to any of your babies. Please leave any comments about what you want to chat next time on Chatting with Chitness.